Good morning. We're coming on the air right now because President-elect Biden is about to just met with his coronavirus task force. He's just started speaking. Let's listen in.
Today, that work begins. It starts with doing everything possible to get the COVID-19 under control so that we can reopen our businesses safely and sustainably, resume our lives, put this pandemic behind us. And we just received positive news in this fight with the announcement that there's been progress made toward a successful vaccine. Soon, the expectation is the FDA will run a process of rigorous reviews and approvals. And the process must also be grounded in science and fully transparent so the American people can have every confidence that any approved vaccine is safe and effective. At the same time, it's clear that this vaccine, even if approved, will not be widely available for many months yet to come. The challenge before us right now is still immense and growing. And although we are not in office yet, I'm just laying out what we expect to do and hope can be done, some of it between now and the time we are sworn in. But so the purpose of this is to let you know what we're going to do once sworn in. And so there's a need for bold action to fight this pandemic. We're still facing a very dark winter. There are now nearly 10 million COVID cases in the United States. And last week, we topped 120,000 new cases on multiple successive days. Infection rates are going up, hospitalizations are going up, deaths are going up. This crisis claimed nearly 1,000 American lives a day, and nearly 240,000 deaths so far. The projections still indicate we could lose 200,000 more lives in the coming months before a vaccine can be made widely available. So we can't forego the important work that needs to be done between now and then to get our country through the worst wave yet in this pandemic, to reduce the spread, to save lives. So that's why today I've named a COVID-19 Transition Advisory Board, comprised of distinguished public health experts, to help our transition team translate the Biden-Harris COVID-19 plan into action, a blueprint that we can put in place as soon as Kamala and I are sworn in to office on January 20th, 2021. And we'll seek to add other members to this board during this bring additional important perspectives on public health and expertise throughout the transition. This group will advise on detailed plans built on a bedrock of science and to keep compassion, empathy, and care for every American at its core, making rapid testing widely available, more widely available, much more widely available, and building a core of contact tracers who will track and curb this disease while we prioritize getting vaccines first to the most at-risk populations. Developing clear and detailed guidance, providing the necessary resources for small businesses, schools, child care centers to reopen and operate safely and effectively during the pandemic, protecting both workers and the public. Scaling up productive life-saving treatments and therapeutics, and when it's ready, making sure an approved vaccine is distributed equitably and efficiently and free for every American. With cases rising once more, it's imperative that we ramp up our production of personal protective equipment to make sure our brave healthcare workers have what they need to do battle safely against this virus. We're going to get states, cities, and tribes the tests and the supplies they need. We're going to protect vulnerable populations who are at risk, most at risk from this virus, older Americans and those with pre-existing conditions. We're going to address the health and economic disparities that mean this virus is hitting the Black, Latino, Asian American, Pacific Islanders, Native American communities harder than white communities. Focusing on these communities is one of our priorities, not an afterthought. The bottom line, I will spare no effort to turn this pandemic around once we're sworn in on January 20th, to get our kids back to school safely, our businesses growing, and our economy running at full speed again, and to get an approved vaccine manufactured and distributed as quickly as possible to as many Americans as possible, free of charge. We'll follow the science We'll follow the science. Let me say that again. And we'll adjust to new data when it comes in. And we'll listen and work in cooperation with governors and local leaders of both parties who are fighting this virus in their communities this very day. There is so much good work happening at state and local levels across the country. Governors, mayors, they're stepping up. The advisory board will listen and learn lessons from their experience. And because we know that we won't fully defeat COVID-19 until we defeat it everywhere, my advisory council also includes experts on global health security so that we can restore U.S. global leadership to fight this pandemic. This is a crisis that affects everyone. As I've said throughout this campaign, I will be a president for every American. This election is over. It's time to put aside the partisanship and the rhetoric that designed to demonize one another. It's time to end the politicization of basic, responsible public health steps like mask wearing and social distancing. We have to come together to heal the soul of this country so that we can effectively address this crisis as one country where hardworking Americans have each other's backs and we're united in our shared goal, defeating this virus. As we work toward a safe and effective vaccine, we know the single most effective thing we can do to stop the spread of COVID is wear a mask. The head of the CDC warned this fall that for the foreseeable future, a mask remains the most potent weapon against the virus. Today's news does not change that urgent reality. I won't be president until January 20th, but my message today is to everyone is this: it doesn't matter who you voted for, whether you stood, where you stood before Election Day. It doesn't matter your party, your point of view. We can save tens of thousands of lives if everyone would just wear a mask for the next few months. Not Democrat or Republican lives, American lives. You know, maybe we'd save the life of a person who stocks the shelf at your local grocery store. Maybe it saves the life of a member of your place of worship. Maybe it saves the lives of one of your children's teachers. Maybe it saves your life. So please, I implore you, wear a mask. Do it for yourself. Do it for your neighbor. A mask is not a political statement, but it is a good way to start pulling the country together. I want to be very clear. The goal of mask wearing is not to make your life less comfortable. It's to take something away from you. It's to give something back to all of us, a normal life. The goal is to get back to normal as fast as possible. And masks are critical in doing that. It won't be forever, but that's how we'll get our nation back up to speed economically, so we can go back to celebrating birthdays and holidays together, so we can attend sporting events together, so we can get back to the lives and connections we shared before the pandemic. It doesn't matter whether or not we always agree with one another. It doesn't matter who you voted for. We are Americans and our country is under threat. And now, we're now called to do the same thing that generations of proud Americans have done when faced with a crisis throughout our history. Rise above our differences to defend the strength and the vitality of our nation. You know, that's the character of patriots. That's the character of Americans. We have to do this together. Wearing a mask may seem like a small act. Maybe you think your individual choice won't make any difference. But throughout our history, throughout the history of our nation, we've seen over and over how small acts add up to enormous achievements. It's the weight of many small acts together that bend the arc of history. You know, I know there's nothing the American people can't accomplish when we work together as one people with one mission. We can get this virus under control, I promise you. We can rebuild our economy back better than it was before. We can address race-based disparities that damage our country. It's in our power. So let's wear a mask. Let's get to work. Thank you. May God bless you. And for all those who've lost somebody, our heart goes out to you. We know what it's like. our heart goes out to you. May God protect our health workers and our healthcare workers and all Americans. Thank you.
President-elect Joseph Biden right there making it clear, getting this virus under control, his number one priority as president-elect, his number one priority as president. Welcomed the promising news perhaps on the vaccine, but also repeated his core message again and again and again, the importance of wearing a mask. I want to bring in Dr. Jen Ashton right now. And Dr. Jen, let's begin with that news that we heard this morning, Pfizer announcing that their two-shot vaccine, they said, had 90% effectiveness in clinical trials. Put that in some perspective.
Well, George, obviously all eyes of the world looking for some glimmer of hope in the battle against this virus, and it may have gotten it with today's news from Pfizer. A lot to unpack with their particular trial. First of all, they are the largest. It is a 2-dose series of vaccines. It does not contain any part of the SARS-CoV-2 virus. It uses a new technology known as messenger RNA. And in their phase 3 trials, which have enrolled over 43,000 volunteers, 42% of which come from diverse racial and ethnic backgrounds, they are showing more than 90% efficacy at preventing disease. I spoke to the CEO, Dr. Albert Bourla, earlier today, and he told me the key will be the safety data, which will be coming shortly in the next couple of weeks. The key point, George, with that safety data, anytime you do a clinical trial looking at a vaccine for side effects, there's short-term safety and long-term safety. If they go for emergency use authorization, which they are expecting to do with the FDA as soon as they get the safety data, they will have just over 2 months of safety data available. That's very different than the typical 2 years of safety data that we normally see with a vaccine. Dr. Bourla, the Pfizer CEO, told me that they will be continuing to follow possible adverse effects and safety very, very closely. And I've been in touch with the heads of the FDA vaccine development trials, as well as Commissioner Dr. Stephen Hahn, and they have both assured me they will make this decision based on, quote, undistracted science, not politics.
And Jen, do we know, was this working in mild cases, severe cases?
They don't know that yet. What they know is that 94 cases of COVID-19 were detected. They have to have some positive cases. Remember, they're putting this head-to-head against placebo, and that's why they've had to enroll so many thousands of volunteers. So efficacy, very, very important. The other thing that is looked at when you study a clinical trial for a vaccine development is not just whether it can prevent someone from getting sick, but whether it can possibly lower the chance of spreading or transmitting that infection to others. We don't know that yet. We also know that Pfizer has broadened their participant pool to include teenagers as young as 12. They are looking at older individuals also, which will be very, very important in this.
Okay, Jen, thanks very much. Rebecca Jarvis, our chief business correspondent, Wall Street, focused on the positive.
Absolutely, George. And this is some light potentially at the end of the tunnel. You have the Dow up today more than 1,000 points. The S&P 500, which is the thing in most people's 401ks and retirement savings account, up almost 3% right now. And this really, while it doesn't necessarily change how people will behave today, you still have a coronavirus. You still have 6.9% unemployment in this country. There are still millions of people who are out of work, and unfortunately millions who have slipped into poverty in the last handful of months as a result of the economic toll that this pandemic has taken. People can change their spending habits as a result of news like this, and I'll tell you what that looks like. So if you take a look, for example, our transportation correspondent, Gio Benitez, has been reporting about United bookings for airline tickets. And right now, about half of passengers aren't booking tickets more than 30 days out. Well, once you have an idea that there might be a vaccine coming down the road, you can start to think a little bit farther out with your life. You can plan that family vacation for some time later next year. You might be able to think about having a wedding or many different things that you might not have been thinking about yet. At the same time, we still have a number of cases here in this country. You still have them happening around the world. And so when you look at the more near-term effects of this virus, they're still there, and especially there if you happen to work in a service industry where you're interacting with customers a lot. George, there are about 350,000 small independent restaurants in this country. They still have to make it through this winter. And of course, there are all of those unemployed Americans who had their benefits dry up, those additional benefits dry up at the end of July. They are still waiting because the additional stimulus that's been talked about for many months now still isn't there.
No question about that. And even if this vaccine is approved for emergency use, it could be many months into the summer before you have any kind of mass distribution. We also know that the vice president is going to try to get involved in these stimulus negotiations as well. I want to bring in Mary Bruce. Mary Bruce, no accident that the first act by the president-elect appointing this task force, his first meeting with that task force, his first press appearance on that task force.
Joe Biden and Kamala Harris are eager to project leadership, especially on this, which is their first priority. They wanted to be very clear to the American people that on day one, they will be in a good position to begin tackling this crisis, leading the country out of this pandemic. He has now appointed this 13-member panel, this coronavirus task force. It is a diverse group with bipartisan backgrounds, many familiar names like the former Surgeon General Vivek Murthy, the former FDA Commissioner David Kessler, people who have been dealing with similar issues in some ways in the past. And we have heard Biden for months talking about this plan to increase testing, increase contact tracing, to urge governors to issue a mask mandate, also to look and study more closely the racial disparities at the heart of this pandemic. The challenge now for this new panel is to try and take all of those promises and turn them into action. And George, one of the most challenging aspects about this is actually something that's less tangible. And you heard Joe Biden alluding to this there at the end. We are a bitterly divided country where even wearing a mask has become incredibly politicized. And you heard Joe Biden hinting at this, urging everyone to please put politics aside, wear your mask, because they know that in order for his plan to be successful, he's going to have to get Americans somehow on the same page here.
Wear a mask for the sake of your friends, families, and neighbors. That was the core message of Joe Biden today. Mary Bruce, thanks very much. We're going to return now to our regular programming. Coverage will continue on ABC News Live. Of course, a full report tonight on World News Tonight with David Muir. Have a good afternoon.